On that note, I'm handing it over to the lovely Shayna.
Thank you, Steve. I don't know how I'm going to follow up with that. Thank you for that beautiful introduction. So I think it's important, like Steve and I are both old school, and you can see that he can see the changes that have happened over the past few decades, as have I. And for those of you that don't know me, I'm Shayna Stockman. I've been a registered nurse now over 30 years, a nationally board certified nurse practitioner, a #1 international best-selling author of this book, and I'm now known as the autoimmune expert and the WorldWellnessExpert. I think a lot has changed over the years, and I don't know why I'm nervous now. I just spoke in Nashville recently. There was about 7,000 of us, and I was less nervous. I don't know why. You know, my career began when my grandma raised me in the 1970s with the power of the plant and naturopathy. And you guys go, feel free to eat, don't bother me. My grandma raised me in the 1970s with the power of the plant, and I would watch her use plants for their medicinal purposes. Now, Steve talked about root causes, and we have to go back to that. Because when my grandma raised me, I would watch her use the power of the plant for medicinal purposes and not need medicines. For her heart, to control her arrhythmias, irregular beats, and other things. I'd watch her salt, not need a blood pressure pill. I'd watch, and this is going back over decades. I'm talking in the 70s. I watched my grandmother, all of her siblings, brothers and sisters, had diabetes. And she decided, just because you have a gene for a disorder like diabetes or cancer, does not mean that gene is going to be expressed. So I learned not from what she told me, but observing her. And I would watch her, watch what she eat, watch the processed food, stay skinny, and never develop that gene for diabetes. So although we can't change our genes, we can change if they're expressed. And, I think we're both old school, the way he's talking and the way I'm talking. And the power of the plant, naturopathy was pretty much wiped out by Rockefeller, and I don't want to get into all that. But, I went into nursing to help people get better and not keep them sick. And I think, honestly, if we're going to talk about how society's changed the past 3 decades, because I didn't know what I was going to say till I got up here and I heard Steve's talk. But after seeing how he said that we've changed over the past few decades, we used to look at the power of the plant for medicinal purposes. We didn't use medicine. My grandma would eat a banana every day for her potassium, her magnesium, so she wouldn't need a blood pressure pill. Sometimes we need to go back to old school, and Steve talked about root causes, like why Hempstead might have excruciating higher expenditure on education, but yet their grades are poorer. So we have to go back to the root causes of things. And that's what we're not doing. And I think, I went into medicine and nursing to help people get better, and it kind of changed, to be honest with you. And I went into nursing. A nurse impacted my life. I love science, I love math. I met a nurse, and I said, wait, she likes helping people. I like helping people. She'll never realize how many lives she impacted, and they impacted more. However, being in the medical field for so many years, it's not what I signed up for anymore, to be honest. I went into medicine to help people get better, not keep them sick. But if we're looking at how things changed over the past several decades, it seems like the society is keeping them sick for recurring visits and dependent upon medications to keep them back every month. And it's not, I didn't sign up for the sick care system. I want to get my people better. I get my clients better. And they're like, when do you want to see me again? I'm like, when you need a Shayna tweak. So we have to go back to our roots and find out the root causes of our problems. And a lot of times, medicine's not usually the answer, It's, if we get to the root cause, we can usually stop the progression of the disorder and even reverse it, and the symptoms go away. And then when the symptoms go away, there's usually not need for medicine to treat symptoms that are no longer there. And then without the medicine, we don't have the side effects, the interactions, and lethal overdoses. And I'm sorry, I didn't know where I was going with this until you talked about root causes and how things changed over the decades. But if you guys realize, prescription drugs is one of the root causes, the leading causes of death in the US right now. And yet we're so easy to give a script, and I'll have a patient come in and say, hey doc, give me that shot for the poison ivy, the steroid. And I'm like, wait, you want a shot of steroids and hormones injected deep into your vein for like a little rash? Like, so sometimes we need to just get back to the root causes of things, and I don't want to keep you guys from eating. You're more than welcome to get up and eat. I think I got a few more minutes here. And I wanted to say that if we get to the root causes, it seems like a lot of times the sick care system wants to keep them sick for recurring visits. You know, and a lot of times now, it's sad but true, not all the doctors, but a lot of them are choosing their wallet over the wellness of the patient. And I can personally tell you 2 instances this past year where a surgeon wanted to take out organs of mine that didn't need to be taken out, okay? Tell me that wasn't for greed. So, you know, be your own advocate with your health. Do your research. If you're not getting better and the doctor is like, hey, listen, your tests are fine, that means he might not have ordered the right test. And sometimes it takes years later for the test to show if they have to order the right test, wait for it to be bad enough. And I know so many patients getting gaslit by doctors for years. And the doctors are telling them, listen, your tests are normal, you're just getting older, especially if you're a woman out there. And just to leave you on this, autoimmune, because I only used 5 of my 10 minutes, I'm keeping track here. Autoimmune disorders is one of the top 10 leading causes of death in young to middle-aged women. There's over 100 of them, and I'm just gonna share you my personal story because you might have some of these symptoms or know of people that have them, and they usually don't even know they're autoimmune related. So most patients I see with autoimmune that come to me, they've been to several doctors. They have had several tests, the workup for A to Z, and the doctors don't know what's wrong with them. Try this, try that, let's up the dose. Oh, you're getting a side effect from that med? Let's give you another med for the side effect of the other med. You're not feeling better? Okay, we're gonna add this other med on board. And it seems like a vicious cycle of repeat, another med, add a dose, higher dose, side effect, add another med. And that's not what it's about. Autoimmune, let me tell you some of the symptoms I had, because you guys might have them and it might help someone you know. I don't know if some of you guys want to participate, but how many of you have like hair thinning, right? Or inability to lose weight even though you're watching what you eat? Or you're exhausted even though you're sleeping? Or you're in more pain than you should be? These are just some of the signs and symptoms of it. Or your doc says your blood sugar's a little high, your blood pressure's a little high, you have Hashimoto's hypothyroidism, autoimmune. You have IBS, celiac, gluten intolerance, Crohn's, ulcerative colitis, they're all autoimmune. Hypersensitive reactions, asthma, allergies, eczema. Your doctors might not be telling you they're autoimmune, so they can't treat it correctly. They're not realizing that. So you have to be your own advocate. I was diagnosed with most of those. I was diagnosed with hair thinning, weight gain, even though I was watching what I eat, exhaustion, even though I slept, pain out of proportion. Doctors might look at you like you're drug seeking or just go to give you a narcotic to get you coming back every month. And it'll give you false reassurance your tests are okay. But there's a lot more to it. I had the Hashimoto's, I had weird rashes come and go, things that don't run in my family, asthma, eczema. I was diagnosed with IBS, MS, and heart failure. And I'm like, wait a second, after 30 years being in the healthcare field and seeing patients with autoimmune, no matter which disorder, which doctor, which med, their jobs of those meds was to weaken their immune system. So now their immune system's weaker. They're sick more often. They're sick with more symptoms and more severe symptoms. And I knew when I had my autoimmune disorders, I did not want that. I'm like, I have to do something different to get a different result. And fast forward now, just, you know, my hair's coming in thicker, I'm back to my ideal weight, my sugars are normal, my blood pressure's normal, I have great energy, I'm no more pain, and I take no prescriptions, and I'm not in heart failure anywhere, and all my tests are great, and I haven't had a flare-up of MS in years. And some of my former doctors are my clients now, and there's some that turn a blind eye because they don't want to know, because you know what? I'm not coming in for pain pills every month. And it's sad, but that's the reality of it, because thank you, Steve, for enlightening us on realities, and I just wanted to share that with you guys, that there's a big reality of it, and I'm like 8.5 minutes, so I don't want to keep you guys. So I just want to share that with you guys, and now I want to bridge the gap. I left the sick care system. Now I help people get better and feel better when their doctors or their medicines didn't win or couldn't. And I want to bridge the gap for you, because maybe you can't relate to my story, but your neighbor, your mother, your father, your sister, your brother can. So I want to bridge the gap. I don't want to teach you everything, just, you know, introduce them to me. I have classes, courses, workshops coming up. And now I'm helping other healthcare providers, because the healthcare providers, they feel like if you have cancer, they send you to the oncologist. You need surgery, they send you to the surgeon. Well, you have an autoimmune problem, I'm the autoimmune expert. Like, they're coming to me now. So I want you guys to know that there's resources out there. I do virtual visits, live, you know, workshops and other things. And I work with people one-on-one. I'm starting to do that a little less because there's too many people. So I do online classes, courses, and workshops. But I want to give them hope because mindset's very important. And a lot of times you guys have been given up hope because you went to doctor after doctor after doctor, and they're trying to tell you it's in your head, and it's not. So I want to show you guys that there is hope, and you have to believe to achieve, and then take the action steps. And please reach out to me, connect me with those people you know, and go eat.